Basic waveform analysis in mechanical ventilation is important because it helps in assessing patient-ventilator interaction, detecting asynchrony, and optimizing ventilator settings. The three primary types of waveforms displayed on ventilator settings are pressure waveform, flow waveform, and volume waveform. These ventilator graphics typically include waveforms and loops that represent pressure, flow, and volume changes. Any single variable displaced against time is known as a scalar graphic. The three components that make up the ventilator graphics, flow, volume, and pressure, are plotted against time. These three scalars are generally referred to as flow curve, volume curve, and pressure curve. Loops are the two-dimensional graphic display of two scalar values. There are two loops available for interpretation. They are pressure volume loop and flow volume loop. In spontaneous breath, please observe that the inspiratory flow is traced above the baseline, whereas expiratory flow is indicated below the baseline. The flow time curve for spontaneous breath resembles a sine wave flow pattern. In mechanical breath, observe the inspiratory flow pattern is square, indicating constant flow delivery. This pattern is selected by the operator. There is a significant tracing below the baseline, representing expiratory flow, which is dependent on the patient's lung characteristics and effort. Only the flow versus time curve demonstrates a significant tracing below the baseline. Most ventilators allow clinicians to select a flow pattern that is most suitable to the patient. Observe that in each flow pattern illustrated in this frame, the maximum flow rate is the same and inspiratory time varies. This slide shows initiation of a flow at the beginning of inspiration, and also it shows the initiation of expiration. Normally, expiratory flow returns to the baseline prior to the next breath. In the event that the expiratory flow does not return to the zero uh, and the subsequent inspiration begins below the baseline, this is auto beep. Auto beep or air trapping is present as you see in this graph. Information obtained from the volume versus time scalar graph include a visual representation of inspiratory tidal volume, inspiratory phase, inspiratory time, and inspiratory hold if applied. Notice all of those are above the baseline. A leak in the circuit or around the tracheal tube can be detected from the volume time curve. If the expiratory tracing smoothly descends and then plateaus, but does not reach baseline, it indicates the presence of a leak in the system. This pattern mandates that the leak should be located and fixed. The volume of the leak can be easily estimated by measuring the distance from the plateau to the end of the expiratory tracing. Forced exhalation is seen on the volume time tracing as a tracing that extend below the zero line. It can also occur if the flow transducer is out of calibration. The pressure verse time scalar indicates inspiration below the baseline and expiration is traced above the baseline, which is consistent with the normal spontaneous respiratory pattern. Observe that during the inspiratory phase, the pressure curve shows a negative deflection and during exhalation goes above the baseline. Peak inspiratory pressure is the maximum pressure achieved during the breath. Peak inspiratory pressure indicates the pressure required to deliver a set tidal volume during volume ventilation. Increased airway resistance or decreased lung compliance results in an increase in the PIP. PEEP is confirmed only when a pressure verse time scalar and the pressure volume loop. PEEP is present when the baseline pressure is above zero. In this slide, we will see assisted breath versus controlled breath. In the assisted breath, as you see, there is a deflation below the baseline. The plateau pressure is the same as the alveolar pressure. These measurements provide a means of measuring static lung compliance. Trans-airway pressure equal PIP minus plateau pressure, which reflects the pressure required to overcome airway resistance. Four common situations are demonstrated in the following tracing. Normal curve indicates PIP, plateau pressure, trans-airway pressure, inspiratory time, high airway resistance. A significant increase in the trans-airway pressure is associated with increase in airway resistance. The third graph shows high flow. Notice that the inspiratory time is shorter than normal, indicating a higher inspiratory gas flow. And finally, decreased lung compliance, an increase in the plateau pressure, and a correspondence increase in the PIP is consistent with decrease in lung compliance. A pressure verse time curve can also detect inadequate flow that is indicated when the pressure rises very slowly or sometimes is indicated when there is a depression in the respiratory limb of the pressure contour. Observe the direction of the tracing of the loop. When the tracing is counterclockwise, the breath delivered is a mechanical breath. On the other hand, a clockwise tracing indicates spontaneous breath. The angle, shape, and size of the loop impart pertinent information to the clinician. In an assisted mechanical breath, the tracing begins clockwise, indicating patient's effort, and resumes in counterclockwise. It is important to recognize that the beginning point on a pressure volume loop is the FRC level. When beep is added, the FRC level increases. A pressure volume loop traces changes in pressure and corresponding changes in volume. Inspiration begins from the FRC level and terminates when the preset parameter is achieved. The tracing continues during expiration and returns to FRC at end of exhalation. PIP and delivered tidal volume can readily be obtained from the pressure volume loop. When PEEP is applied, the pressure volume curve shifts to the PEEP level on the horizontal scale. Inflection point is the point of change in the slope of a line. The inflection points represent sudden changes in alveolar opening and closing. The lower inflection point represents the opening pressure, where the proper inflection point represents recoiling characteristics. The higher the opening pressure, the stiffer the lung, as indicated by the curve moving lateral to the right along the pressure axis. Setting beep levels at the level of the lower inflection point is recommended to optimize alveolar recruitment and prevent repeated opening and closing of the alveoli. A shift of the curve to the right of the pressure volume loop indicates decreased lung compliance. A shift to the left is associated with increased compliance. Observe the pressure required to deliver the same tidal volume in the three graphics. The major advantage of a pressure volume loop is that it provides a quick assessment of the elastic as well as resistive work of breathing. Since work of breathing is calculated from the product of pressure and volume, the shaded area represents elastic work of breathing. Volume targeted ventilation. Notice that in volume targeted ventilation, the PIP is changing a variable. In pressure targeted ventilation, the PIP is the constant variable and tidal volume is changing variable. Decreased lung compliance. A shift of the curve to the right of the pressure volume loop indicates decreased lung compliance, and a shift to the left is associated with increased compliance. Observe the pressure required to deliver the same tidal volume in the three graphs. An increase in the airway resistance associated with the abnormal widening of the respiratory tracings. Patients with obstructive disorders exhibit a wide pressure volume loop. This abnormal widening of the shape of the PV pressure volume loop is referred to as increased hysteresis. Increased hysteresis. Alveolar distension is a common observation made during ventilation of patients with ARDS. On a volume-targeted mode, alveolar overdistension is determined to patients. The classic sign, known as beak effect or duck bill, shows an increase in airway pressure without any appreciable increase in volume. A switch to pressure-targeted ventilation at appropriate safe pressure level or a reducing in tidal volume are indicated. Normally, the pressure volume loop traces in the counterclockwise direction. A clockwise tracing prior to the initiation of a mechanical breath is indicates patient effort. Adjusting the sensitivity can minimize this effort. Inadequate sensitivity setting promotes increased work of breathing. On the pressure volume loop is as you see here on this one, the sensitivity is shown very clear. Inappropriate inspiratory flow rates are recognized from a scooped out pattern. In some situations, the patient makes inspiratory effort in the middle of the mechanical breath exhibiting a notch on the respiratory curve. Inappropriate inspiratory flow rates are recognized from the scooped out pattern, as you see in this slide. When expiratory curve does not return to zero volume and air leak is present, this is where we have, as you see, leak, air leak. A flow volume loop provides the following information: PIFR, peak inspiratory flow rate, peak expiratory flow rate, tidal volume, and it also provide the FRC and provide end expiration and beginning of inspiration. The deficit of volume indicates the magnitude of air leak. Ideally, expired volume should be equal to the inspired volume. With air leak, however, expired volume is less than inspired volume. This is commonly observed in situations such as leak around the endotracheal tube and circuit leak. A leak can be identified from a flow volume loop when the volume does not return to zero volume level. In air trapping or auto beep, the flow does not return to zero level. Since the next inspiration must begin from the zero flow level, the tracing jumps abruptly from the trapped level to the zero level and proceed with next breath. A continued scooped out appearance and a low peak expiratory flow rate indicate ineffectiveness of the bronchodilator therapy, and this increase airway resistance. The presence of secretions in the large airways as well excessive fluid condensation in the ventilator circuit appear as distinctive pattern in the flow volume loop known as sawtooth, which occurs mostly on the expiratory component of the curve. If the situation is not corrected, this pattern will also appear on the inspiratory curve. Those are some slides will give you some feedback and brainstorming. What does this loop indicate in this slide? What does this loop indicate in this slide? What does this loop indicate? 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 Assessment of a pressure, flow, and volume waveforms is a critical tool in the management of the mechanically ventilated patient. When you see the following scalars, what action should you do? Identify the sine waveform in the figure. What is the problem in this case? What is the type of breath shown in the flow volume loop? This will end flow volume loop. Thank you for listening.